Good morning, everyone. Thank you, Dr. Burney and the Planning Committee for having me speak today and for our moderators this morning. So I'm going to be discussing the challenges of inclusive leadership in sexual medicine. These are my disclosures. And then just briefly, although our time is limited, just want to kind of have a few bullet points of what we're going to be going over. I'm going to be defining inclusion as it relates to diversity and equity. We're going to define the principles of inclusive leadership. We're going to be discussing some challenging issues that are pretty specific to our subspecialty here in sexual medicine, and then identifying some actionable ways to promote an inclusive environment. So what is inclusion? So inclusion is the intentional incorporation and integration of the perspective and contributions from diverse parties in the workplace or group setting. Examples include fostering connections, like we're doing at this meeting, promotions, and shared opportunities. This speaks to the work culture and the feeling of involvement by all members of the work or group environment. But this is harder to quantify. Most of us have probably heard of something that oftentimes gets conflated with inclusion, but is not the same, which is diversity. So why should we care? So we know that it's well established that diversity drives organizational excellence and competitive advantage. Diversity does not equal inclusion. So diversity is a representation of a wide range of characteristics across persons. So that can be sex, gender, race, religion, lots of things can identify people as being diverse. But both diversity and inclusion are crucial to the sustainable success of an organization, a safe culture, and equity promotion. So what is inclusive leadership? This is actually defined by 6 characteristics, and this includes visible commitment, humility, awareness of bias, curiosity about others, cultural intelligence, and effective collaboration. Now, we ask ourselves, how does inclusion impact sexual medicine? So first, inclusion is a key component of retaining faculty, colleagues, trainees. You can also be a part of a diverse group, but not necessarily feel included. And I think those are the nuances that we'll hopefully be able to tease out today. And if you don't really feel included, you may not feel like you can contribute or that you're valued. Lack of inclusion can drive feelings of imposter syndrome and just negative effects on mental health, which this morning we've seen a lot on mental health and that impact on health. And the lack of inclusion really also perpetuates disparities amongst groups that are underrepresented, not only in sexual medicine, but medicine overall. So we do have unique challenges in sexual medicine as it pertains to inclusive leadership. Due to the sensitive nature of our specialty, we have to think about it in a little bit of a different way. So inclusive leadership in sexual medicine has to take into account a wide array of sexual, gender, and cultural disparities, and really strive for an environment that serves the needs of all individuals. So I'm going to be diving into gender bias and representation, cultural differences, health disparities, and psychosocial issues. So sexual medicine is still heavily dominated by men, with underrepresentation of women and other non-binary groups. This does lead to male-centric research and treatments, with the sexual health needs of women, members of LGBTQIA+, and gender non-conforming individuals being inadequately addressed. And this also impacts representation when you think about organizational leadership. Now, cultural differences in sexual medicine, which we can all attest to, we know that sexual medicine topics are variably discussed and accepted across cultures. We have to think about respect for certain cultural sensitivities, and this is key when we're thinking about addressing the diverse sexual health needs, not only amongst ourselves, but also of our patients. And this also impacts our interactions. So we also have to think about comprehensive sexual education, which is largely lacking across the United States and the world, quite honestly. So this also presents knowledge gaps when we think about sexual health and some options that our patients may be faced with. Health disparities in underrepresented groups, that is not unique to sexual medicine. This unfortunately pervades all aspects of medicine, but racial and ethnic health disparities stem from systemic biases, racism, and stereotypes of hyper and hyposexuality depending on across different cultures. And then we also have disparities in access to sexual medicine from individuals in the LGBTQIA+ communities, which is exacerbated, unfortunately, by discrimination from healthcare providers. And then lastly, psychosocial issues. So we also know that there's quite a bit of intersectionality with sexual medicine, with mental health and trauma. Sexual health is also significantly impacted by social determinants of health. So we think about the impact from poverty, education, and healthcare access. And then we also have power dynamics. Sexual medicine and just sexual health issues are not easy to discuss. And so we have to think about the power dynamics that are present, not only in our patient interactions, but even amongst ourselves as colleagues. And then lastly, thinking about ethical issues of consent, reproductive rights, and legal barriers to inclusive sexual health practices. So now that I've talked about all of these issues, don't worry, there's hope. We don't have enough time for me to delve into all of the solutions, but for anyone who knows me knows that I love acronyms. And so I have an acronym for this, so feel free to take a picture. These are just, this summarizes actually some tips on how we can promote an inclusive leadership in sexual medicine. This can, of course, be applied in kind of different fields, but this really, I think, is an easy way to hopefully remember, so I'll kind of start with each part of that. But the crux of this is that inclusive leadership has to ensure that we are addressing the needs of underrepresented groups in sexual medicine, marginalized groups when it comes to sexual identities, and that everyone has the appropriate access to healthcare providers and also to opportunities. So we want to implement inclusive principles and policies and clinical practices. We want to think about nonstop learning. I mentioned before, one of the tenets is just being curious, right? We have to constantly be in lifelong learning mode when it comes to this. Focusing on cultural competency for care. There's lots of cultures. I don't expect everyone to be an expert in that, but you should at least make an attempt to think about how this impacts your interactions with patients and amongst ourselves. Leadership opportunities, across all groups in sexual medicine. Although I think our organization has made great strides, actually, and great progress, we still have a ways to go. And so I think thinking about whether it's a committee or anything else, think about how you can extend some of those opportunities to other groups that may be underrepresented on that level. So we want to understand patient-provider dynamics. I discussed that this is a sensitive topic, and so we have to keep that in mind when we are engaging with patients. D, diverse representation in clinical trials and research. We have, especially at this meeting and as meetings have progressed, a lot more information around female sexual dysfunction and sessions, but this is still largely very male-centric when we think about the issues that we're addressing. So we want to continue to strive for more diversity in trials and research. And then lastly, E, education. We want to focus on education that is inclusive and comprehensive. It is really up to us as stewards of sexual medicine to think about how we are educating the public and ourselves on sexual medicine. So in conclusion, inclusion and diversity are necessary components of a supportive environment and are markers of organizational excellence. Diversity does not equal inclusion. Principles of inclusive leadership present several unique gender, cultural, and psychosocial challenges in sexual medicine, and recognition of these issues are important when we're considering the implementation of inclusive principles. Becoming an inclusive leader is an ongoing journey that requires continuous learning, self-reflection, and adoption of strategies outlined in my Include model. Those are some references here from what I discussed today, and feel free to reach out if you have any questions. Thank you so much for having me.